Hello everyone and welcome to our Monday Minute. Today we're here to discuss some very important home health advocacy that we need you to participate in. There was recently a bipartisan act released by Senators Stabenow and Collins that is extremely important to the livelihood of home health agencies. Preserving Access to Home Health Act of 2003 is the legislation that we are discussing today that is imperative that you participate in contacting your representatives to ensure that we get full support for the passing of this act. The Preserving Access to Home Health Act of 2023 is specifically put together to ask Congress two very important things. Number one, to remove the requirement for CMS to make adjustments such as the behavioral adjustment when a payment system changes. So for home health, there was a behavioral adjustment requirement in place that when the system changed from the prospective payment system to the PDGM model, there had to be a behavioral change adjustment made to say that once we moved into the PDGM model, the behavioral changes that would take place would impact the difference in our reimbursement, and that adjustment would have to be taken. Never have we agreed with the methodology that is being utilized in calculating this adjustment. And even after CMS was instructed to be completely transparent about this calculation, there still has not been enough detailed information to determine the absolute calculation or source of data to get to the 7.85% reduction that they currently show as the number. So the 7.85%, half of that amount has already been taken out of your rates, and you are suffering from that in 2023. The hopes that this act will not only remove the requirement for CMS to make the adjustment, but to apply it as if it had been part of the 2018 legislation where that requirement originated. The second item included in this act that is extremely important to know is that MedPAC would be asked in their annual reporting of Medicare home health profits for home health agencies, they would use in the calculation all payer information, not just traditional Medicare. Many of you, all of you that are in home health know that we are moving swiftly toward over 50% of patients being a part of Medicare Advantage plans versus traditional Medicare. So how can we base information to Congress on traditional Medicare profits alone when Medicare Advantage is also funded by the Medicare program? So this would require that MedPAC report profitability of a home health agency on all payers, which obviously would include Medicaid patients as well. It's extremely important that we get this legislation passed. We are sitting, waiting patiently for the release of the 2024 proposed rule that will impact our 2024 home health rates. And we are at extreme high risk of additional decreases in reimbursement if this act does not get enforced. We are going to provide a link in this minute to the National Association for Home Care and Hospice Advocacy site where you can put in your name, an address, and phone number. And based on your address, it will pull up your representatives in Congress, and it will send them a message directly from your email address on the click of a button. So advocacy has never been easier. And we need them to hear your voice. Please click that link, fill in your information, and send your representative the needed information for them to understand how vitally important it is that this act gets passed and access to home health be protected. Thank you so much for participating today. And if you need any additional information about this advocacy request, don't hesitate to reach out to Healthcare Provider Solutions, the National Association, or your state association. Thank you and have a wonderful week.